Hey everybody, it's Missy again. As some of you may remember, a couple of months ago, I did a video for Burst TV called Let's Talk About Sex. You should go back and watch it. I sang a catchy little song in it, just so you know. We know that it can be difficult to talk to our patients about subject matters like STDs and their sexual habits and things that we see in their mouth as a result of those habits. But we also know that it's vital, it's important. It not only is about their oral health, but it's about their overall health. I had some really great comments and some feedback from some other Burst ambassadors about things they had seen, patient experiences that they had. So I wanted to interview them because there's nothing like hearing it from another colleague. So I've got a few interviews for you today, and I hope you enjoy. So I really appreciate having Teddy on with me today. She was one of the Burst ambassadors who commented on my original HPV video that she had actually had a patient who'd been diagnosed with it. And I just wanted to pick her brain a little bit and see what happened with that patient or other patients that she might have seen. So welcome, Teddy.
Thank you.
Yeah, thanks for being on here. I hope you're enjoying your coronation as much as you
Yes, I'm trying.
Well,
Try not to
hopefully,
gain weight.
yeah, it should be a good way. Hopefully, a lot of people will tune in because they've got nothing else to do but watch us to talk about warts and lesions. So, how long have you been a dental hygienist?
Well, I have been a dental hygienist since 2007, but total in the dentistry field, it'll be 28 years this year because I'm also a certified dental assistant. Yeah. So,
Woo!
yeah.
You've
It's a
seen
long
a few
time.
mouths then, yeah.
Yeah.
That's awesome. So, the patient that you commented on my post about particularly, can you just give us a little background on that patient, maybe just her health history and what you saw and kind of what happened from there?
Sure. So health history wise, well, first off, she was a female, obviously, and she was in her early 20s. So she's um, apparently sexually active. The only thing that she's ever had in her health history was a spinal had to basically, like straighten her out. And she doesn't have high blood pressure. She doesn't have anything else. So I'm thinking, okay, doesn't take any medications, all this kind of things. So she had seen the doctor 2 weeks prior to seeing me. And they did all the pictures of the teeth and showing her things that need to be fixed and all that good stuff. And then she comes to me and I'm redoing the extraoral and intraoral exam. Always have my camera ready because I never know what I'm going to find. So all of a sudden I'm asked her to stick her tongue out and bam, there it is. It's like this really globulated, I don't even know how to describe it, but it was like really funky looking. And I was
That
like,
cauliflower-like look, did it look like
yeah,
that?
yeah. And
Because
I was
that's what they
like,
always
holy
say, yeah.
moly. And I was like, no, I'm not sure if he just oversaw that, like he didn't see it, or if he was going too fast. But that's why I always say, 4 eyes is better than two. And I said, I said, have you noticed this thing underneath your tongue? And she goes, no. And I said, well, I'm going to take some pictures and then I'm going to show you with the mirror. So I took some pictures, kind of hard with my camera though, because the light's a little bright. And then gave her the mirror and she goes, I have no idea what that is. And I don't know how long it's been there. And I said, well, I can't really diagnose it. But what I can tell you is that it looks like it might be something that we probably really need to get the doctor back in here to take a look at. She was now, and I told her, I said, nothing to make you really freak out about right at this moment, but I just want to clarify with doctor, bring him in. And he goes, oh yeah. He didn't even glove up or anything. I just pulled the tongue back into, he goes, oh yeah, we might need her to go to the oral surgeon for that. And I thought, okay. And I said, so these are your options. You can either have it biopsied or we can just have it taken completely off and the oral surgeon will talk to you about that. luckily we have an oral surgeon in our office. So we got her signed up and she had it taken off. But prior to that, I told her that she would need to see her OBGYN. And so she went to the OBGYN and she said, well, my dental hygienist found this thing on my tongue. And she says, well, where is it? She says, it's on the left side here. And so she puts some gloves on, she pulls up her tongue and she goes, oh, well, we better make sure that that's HPV. So let's make sure
Wow.
that
It's just like, that's what that is. Like doctors, I think, do that.
And I thought,
different where we have to go, we think it might be. And she's like, that's HPV.
Yeah, she just went, that's HPV. And I thought, oh my gosh. And we didn't really even tell her. We just said, this is something that, you know, might need to be biopsied. We need you to see the oral surgeon for, because we'll let him make that diagnosis. Well, then I just said, you might want to go see your OBGYN. And she was, well, I have an appointment like in 2 days. And I said, great. And she came to me. She actually came to me at the office and she said, guess what? I need to see Teddy. So I saw her and she was, I just want to let you know that I think you might have just saved my life. And I said, what do you mean? And she goes, well, I'm going to have to always be checked, but I have HPV and I want this thing off my tongue and I have the oral surgeon appointment. And then how does that work? And I said, well, he'll explain all that. And I think she had that in 2 weeks from when we found it. So yeah. And she also ended up having to have a LEEP surgery done on her cervix. And I think there was something else, but anyway, she's very, 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 very thankful. So
absolutely. And that gave me chills when you said that she said that. You kind of saved her life, because that's true. She would not have known. I mean, that blows my mind. And she doesn't fit the typical stereotype. You know, when we think about HPV and cancer, we think men, middle age, that's who we usually are looking for. So to be a young woman, that, had you not brought that to the doctor's attention, that, wow, definitely could have been.
Yeah, and then she shared with me, of course, that, well, now I've got to make sure I tell everybody that I've ever been with, because we don't know how long I've had it and I don't know who I got it from. And she didn't go quite, into all of that, but she was just like, holy moly. And I can't even, stress, of course, then makes things worse. So I said, okay, now listen, just breathe, don't stress over it. This is just something that happens. So you're just going to have to call them and say, I just need to tell you something, even if it's somebody that, you're not really liking to talk to anymore, I mean, but they have to know, because then they need to be checked as well.
That's so good that you even went that far. And I was thinking, in your initial appointment to say, listen, you probably need to see your OBGYN. I mean, to go that far, because I think a lot of us hesitate at that moment. Like we know what it is, but then we can't diagnose, whatever. So we get the doctor and we say, we're going to do biopsy. But to have the courage, I think, to stand up as a professional and say, here's what else you need to do.
Right.
I think that is the key.
Yeah, I always do that. I mean, I see something on somebody's lip and I'm like, how long has that dark spot been there? And then they go, what do you mean? And I'm like, well, let me give you a mirror. Let's take a look at this. And then they go, I've never really noticed it before. And I'm like, maybe something you need to see your dermatologist about. Do you have one?
Yeah.
If you don't, can I help you find one? That's what I always do.
Good on you, because what I think happens a lot of times, and I think all of us have maybe been guilty at some time or another, being a little complacent and maybe, I'm running behind. I don't really want to do this exam, intraoral exam, and I don't want to, I want to take a minute. And that's been there. I've seen that before. But to really take that time is amazing. I hope that everyone watching right now really heard that and really got that, because we really can save lives, and that's what makes the difference. I think when people, I know when was it Michael Douglas that came out and said that he had throat cancer and it was from HPV, it was from oral sex. That's when everybody kind of sat up and listened when someone famous said it, and then we figured out the link, and then it became more important, and we became lifesavers. I mean, truly, you are a lifesaver. How cool does that feel? I would be like,
It does.
Really?
It actually makes me choke up a little bit.
Oh, really? I mean, because a young woman, I mean, that really could have gotten bad quick. So,
Yeah.
wow. So proud of you. So glad that we got to
Thank
talk about
you.
this because that gives me like motivation to get when I do get back in the operatory to really take
Yeah.
that extra time and care even more than I did before. Not that I didn't, but that is awesome. I really appreciate that. I don't know why I'm geeking out a little bit because I'm just so in awe of that you did that and excited about. Wow, I'm so glad we talked. This got me jazzed. This made my day. So now we are talking to Andrea Walsh, who is one of our senior ambassadors in the Northeast. Welcome, Andrea.
Hi, Missy.
Hey, good to see you.
You.
I miss your face.
I miss your face.
One day we'll hug again when we can touch each other. So I can't wait to get all the touching in.
Yeah.
But of course, today we're talking about some that you had a patient that you saw HPV on, or you had a suspicion and kind of went from there. And I just wanted to get your input on what you saw and what happened with your patient and your experience.
Sure. So yeah, I had a patient who she was about 19. She comes in regularly for her 6-month hygiene visits. And she had a raised pedunculated looking lesion on her soft palate. So for anyone that doesn't know, it kind of looks like a wart. So I did mention it to her that she had a lesion that looked a little concerning, and I was just gonna have the doctor take a look at it. So when the exam happened, our doctor said that she reassured her, like, it doesn't look like cancer, but just to be sure, we should do a biopsy. So it did come back as HPV.
Oh.
Yeah. So
Young, very young to have already. Doesn't that seem? I mean, I think to be young and a female, like that's kind of out of the norm of what we usually think about when in my research. You think about a middle-aged man,
right.
Or something. So that was wow. That was. So did she follow? So she followed up. It was HPV.
It was HPV. It wasn't one of the strains that is a high risk for oral cancer, which was good. But I guess the lab considers it a strain that can seed like a wart would. So any other lesions, they recommend having them removed just so that they aren't like multiplying.
Oh.
Yeah.
That is. I didn't think about that. That is seeding. That
I
sounds.
know. Yeah.
Oh, because the one I saw, I've only seen one ever, and it wasn't in a patient of mine, but it looked just like that cluster of like grapes or cauliflower. Is that kind of what it looked like?
Yep, just like cauliflower, and it's the same color as tissue. But yeah, it does look like cauliflower raised. And I've actually seen a few lesions like that, and so far they have always come back negative or not like a cancerous strain.
Wow, that's
good.
Let me ask you this, because on our health history, and I just wonder about what you think about the future, where this is going for dentistry. But like, I would imagine I don't ask on my health history about their sexual history, like how many partners have you had? Do you ask that on your health history in your office?
We don't. And honestly, I feel like it is a touchy subject, but I do think that we are responsible for finding out because that is a huge risk factor for HPV. But yeah, it is a question on how do you ask that, especially for like a shy 19-year-old girl. I don't know how she's going to feel.
Right. Would they be honest? Would they even, that could be really off-putting. I just wonder, because I was thinking, how can we help and get more information so that we can really be focused on the patients that are higher risk? But I guess it's just like anything else. You have to assume that anybody could have it because assume they're not being factual, regardless. Just like with HIV, we have to assume anybody is sexually active and could have it.
Yeah.
So yeah, was just off the cuff question. That wasn't part of it. I was just like, I wonder if we're going to ask that, because I thought
to put it on the health history. Just, I mean, they don't have to answer, but that puts you at a high risk. I mean, we ask, are you a tobacco user, or do you smoke? Do you use marijuana?
Right. I mean, I just think that could be something that we're going to be, because now that more medical practitioners are realizing that we're really on the forefront of finding a lot of these lesions that they normally wouldn't find, I think I think it'd be a good thing if it did come to the point where, hey, that's a standard dentistry. You're going to have to ask your patients about their sexual history and really get to know, just if nothing else, to start the dialogue of, well, the reason we asked this is because.
Right.
of HPV and leading to certain types of cancer. So
Yeah, yeah. The head and neck oral exams are so important, and that's just part of it.
that is good. So you do that on every patient or just once a year or?
I do it on every patient. I always start with the neck and then move into the mouth.
So how often do you see anything that is suspicious? Just curious.
I feel like I've been seeing it more and more, honestly. So it is a little alarming. I don't know if people are being more promiscuous or not, but I would say at least once a month I see a lesion that I bring up. We do a lot of biopsies, and our doctor uses a laser, so that definitely makes the healing a little bit easier. But usually it's quick and painless. Yeah.
Good. So, oh, and I was going to ask you about this, since your thoughts on this as a mom, as a new mom of a boy, and not that it matters if it's a boy or girl, but when my son, I knew when they came out with the HPV vaccine, it was just for girls.
Right.
They're recommending it, and that was way after my time. I couldn't have. They were like, "No, it's way too late for you, sister. You don't get one." But so I really did ask, and I was like, "Oh, okay." But when I took my son to get some immunizations for school, I think he was 16, and they said, "Do you want to get the HPV vaccine?" And I was like, "Wasn't that just for girls?" I didn't even know they had it for boys yet. And
Yeah.
no, it's for boys. And I was like, "Yeah, I just didn't know." It caught me off guard. So I was like, "Let me just hold up and research this," because I didn't, I just wanted to figure it out. And that's been 4 years ago, and I still haven't started that round for him, just because I was not sure. But of course, now I've done my homework, and now I think it is safe. I'm not worried about him. So have they don't start that though until like the teen years, or do you know when?
I think girls are 11.
Okay.
Yeah, but I think it's great that they're doing boys too, because obviously they're going to pass it back and forth if they have HPV. So if you can prevent it in both sexes, why wouldn't you?
Yeah. Thanks for sharing your story. I think that was really an eye opener, and definitely gives us a lot to think about. Of course, my goal in all this, and your goal in helping with this, is just to get everyone really focused on realizing that we are not just oral prevention specialists, but we can also help prevent a lot of nasty diseases that can lead to cancer. So thanks for helping me today.
You're welcome.
All right, talk soon.
Okay.
So I'm very happy to have Miss Amy French here with us today. She has been a hygienist for how long?
Oh goodness, you got to question me right off.
Hard one.
11 years.
11 years. And she's worked in different settings, from the VA to private practice. So she's seen a lot, and she had shared with me a story about a patient that she'd seen who ended up having HPV, and I just invited her on to share with us today. So just how did you, with your office, do you have any kind of questions on their health history about STDs or sexual history?
So it was not at the office I'm currently working at.
Okay.
And at this particular office, no, we did not at all. But I did know the patient pretty well. And if you know me, I'm pretty outspoken. So I had known this patient pretty well. And he had admitted to me in past, times before that he had had several sexual partners, and of the oral kind. So, just doing his regular head and neck screening, I actually did not see the lesion at first at all. And even used like gauze and kind of pulled his tongue out and looked, base of the tongue, used a mirror, didn't really see anything at all. But I was cleaning, it was on the right side of his tongue, and kind of cleaning the lingual of that, and kind of felt something. And of course, almost gagged him, doing that. And I was like, that kind of felt rough or weird, and I'm so vocal, of course, I have to say that out loud. So, over the patient, which is, things you never want to hear your hygienist or your doctor say, right? So he's like, what do you mean? What do you mean? And I'm like, well, let me just take a look here, So I pull his tongue like way out, and he's kind of one of those patients that has that scallop tongue feature, that
Yes.
way too big. And I pull it way out, and kind of just look again. And I mean, I had to literally stretch it to the point where his eyeballs are like, of course they're not as big as mine. And I say, and I'm looking, I'm like, oh wow, here's this little lesion. It wasn't huge, but definitely noticeable, and kind of felt really guilty that I didn't see that on the first go, and thinking to myself, I've seen this guy before. How long has this been here? This 25-year-old kid,
Oh wow, young. So not older.
Yeah,
That's
not
been because that's been the theme that I've talked with a couple of other girls I've interviewed. Is it's I guess the typical pattern they say is a male in their middle-aged white man, middle class, but we're seeing it in younger people. 25, I think maybe has been the oldest that's been mentioned. It's been younger than that even. So that really kind of, I like that. I mean, I don't like that they're having a problem, but that's good to know that because it kind of raises the red flag for me to start really looking at those kids versus just thinking it's an older middle-aged problem.
Yeah, exactly. Yeah. And I feel like it's a trend, we're kind of seeing younger people having sexual activity a lot younger, admitting they're doing that. It's kind of become less taboo for people to just be freer with,
Right.
activity outside of marriage, that kind of thing. So,
Especially oral sex. Kids don't think that's sex. They're like, I'm still a virgin, I did all
yeah,
this with everybody in town, but I'm okay.
yeah, I'm fine because no penetration. It was
Right.
fine.
Can't get pregnant. No biggie.
Yeah. So
Yeah.
I can do
Can
that.
get,
And I'm
that's-
saying,
yeah.
yeah, and it's kind of our job to educate on that, which, a lot of times I feel like we're embarrassed to say. But of course, anyone who knows me, I'm not even blushing. I'm talking about this and, how red I can be, but it doesn't bother me to talk about it at all. Clearly, I already knew his sexual background. And he was a smoker as well, which I thought kind of had put him at risk. But it turns out later when we found out what strain it was, that was not even a factor. So I was surprised to learn that. I said, no, it really did not put him at a higher risk. I mean, I don't know all the strains and all of that, but
Right.
it was interesting to me to find that out, that had nothing to do with it.
So you went to an oral surgeon, or did you do a biopsy in the office?
No, we didn't do a biopsy in the office that day. We actually were out of kits. It was like a little pandemic of our own with things happening. We did typically do our own testing, but we sent him to an oral surgeon in town. And I was super bummed that I didn't get to watch that. I wanted to see, how we would do that and send it off, but we sent him, he got right in, and it didn't take long to get back, but I was glad I caught it and, wondered how long it had been then.
I know. Well, and that's what I had gone to a CE course with an oral surgeon from University of Tennessee, and he's been the head of the UT, I like their head and neck cancer program for like 30 years, forever. And he said to really, really examine the area that most of it's going to form, there's no way we can get to it. That it's so far back in the throat, it's almost, and by the time it gets to where we can see it, it has been there a while because we just can't get back that far. We can't palpate it because we would gag them. Everybody throw up in our chair if we, and I mean, if that's what it takes, no, I'm not going to do that. But, sorry.
He was actually really funny about it too, because when I did almost gag him, when I'm cleaning, I was kind of being silly about it. I just started laughing. I was like, oh, okay. And he goes, yeah, I know. I still have a gag reflex. And I just died laughing, this kid. And I mean, he's just so funny and free about it, and then, here I find this and I'm like, oh, I wish you hadn't have had that because, I could have probably really gotten to see it and got a better picture for you. We were just cracking up.
Oh my gosh.
He was real great about it. And of course, I'm so nosy. I'm like, please call me. Tell me what happened,
Yeah.
And he actually followed up with me before we even got anything back from the oral surgeon's office. He actually called and let me know. So
that is good. Well, was he like freaked? Was he scared? Did it make him panic? Or was he like, if this happens,
no, he was a little scared, but he was so funny, and I think humor is his way of coping with things. So he was kind of funny about it, like,
right.
Well, I shouldn't have been messing around, I guess, kind of thing. And I'm like, yeah, we did talk about that. We actually did. I'm kind of a mama bear. So,
Yeah.
I had teenage boys and, I'm kind of like, hey, you shouldn't be doing all that. You think you're fine and you're not, but most patients aren't that free with their, sexual history. So, I'm lucky that he even told me that, and I had an inkling of what might be happening. Most people are not going to tell you that information. So I feel lucky.
Yeah. I mean, because, most people are not. They're going to lie to you. I mean, the times I've seen things that I was suspicious about, it was people that were not, totally dishonest about it. Like they were married and it wasn't their, or they were players and sleeping around. So I wasn't going to get the truth from them. So it was just like, we'll send you off. So anyway, thanks for sharing that story with us, Amy. That's really helpful. I think that the whole point of this is just to get us more comfortable, like you are, obviously very comfortable talking about sex with your patients, and maybe we need to have you back and do a Q&A just so we can learn about how to be more like Amy and talk about sex with patients.
Oh gosh, and then watch my dentist see it and just be like, oh, this girl, bless her. He would too.
Thanks for helping us today.
You're so welcome. Thank you, Missy.